Hello, everyone. Allow me to address the issue of single-payer health care. To quote U.S. Senator Bernie Sanders of Vermont, quote, "Health care must be recognized as a right, not a privilege. Every man, woman, and child in our country should be able to access the health care they need regardless of their income. The only long-term solution to America's health care crisis is a single-payer national health care program." Minnesota should opt out of MNsure and Obamacare and replace it with a single-payer health care system that covers all Minnesotans. We need to support legislation like SF 219, the Minnesota Health Plan introduced by State Senator John Marty, and HR 676, the Expanded and Improved Medicare for All Act introduced by Representative John Conyers. In April 2009, Nancy Pelosi told a group of reporters, "All I hear is single payer, single payer, single payer. Well, it's not going to be single payer." Yet, even with a majority of Americans supporting single payer, a majority of nurses and doctors favored single payer, and a majority of health economists favored single payer, Congress wouldn't even debate single payer. In fact, it never made it out of committee meetings because Wall Street buys, sells, and rents lawmakers with corrupt campaign financing. Likewise, we can expect a bewildering attack by the powerful pay-or-die healthcare lobby for any attempt to pass healthcare that is more humane, economically efficient, saves thousands of lives a year, and does it with free choice of doctor and hospital. Extreme public pressure will be necessary, and I'm going to need your help. Opponents of single-payer health care tell us that enormous taxes will have to be raised and we can't afford this expansion of government. But as a percentage of GDP, America spends almost twice as much as other advanced nations, including Australia, Canada, Denmark, France, Germany, Japan, New Zealand, and Taiwan. Which begs the question, do you prefer to pay twice as much in the private sector or half as much in the public sector? Without a reduction in quality, most people would prefer to save money by cutting the cost of health care services in half, even if it does raise taxes. Our parasitic corporatized medical insurance providers provide no health care whatsoever, yet we allow these bloodsuckers to feed on us. What insurance companies do produce is health care rationing, higher prices, diminished choices, and bureaucracy. The great innovation of insurance companies has been to create a third of all healthcare spending that has nothing to do with healthcare. Overhead, underwriting, billing, sales and marketing departments, huge profits and exorbitant executive pay, not to mention the billions wasted and spent on computerized billing fraud and abuse, has become a bureaucratic nightmare. By learning the art of a model fraud control strategy, government and the healthcare industry could substantially cut costs without restricting eligibility, denying the needy, or squeezing honest providers out of business. Yet over 10% of all healthcare expenditures are defrauded, $350 billion a year. We're about half the military budget down the drain. In a single-payer system, you don't have multiple bills, inscrutable bills, fooling around with codes, and you don't have the incentive to exploit patients that can lead to their harm. I invite everyone to read my plan for medical waste, fraud, and abuse control here at votewright.org. Of course, my clueless adversaries have so far refused to debate me on any issue, much less address this issue. Even though it would save Minnesotans over $1 billion per year. Well, that's shameful as far as I'm concerned. Even without single-payer health care, the medical industry does not allow free markets. At the very least, we should demand transparent medical costs that are published for every medical procedure, hospital treatment, and other associated health costs. This would allow folks to shop around for the best prices. Prices vary widely between hospitals and treatment facilities for the same procedures, and increases unnecessary out-of-pocket expenses. But once you have a single-payer health care system, you can demand transparency and reductions to skyrocketing prescription drug prices that are much cheaper in Canada and Western Europe, even though the drugs were produced in America with taxpayer money. Yet we are the first to be gouged by these ungrateful drug companies. Johns Hopkins University Medical School estimated that about 5,000 people die per week from preventable problems inside hospitals, hospital-induced infections, malpractice, etc., are diminished significantly by a single-payer system. To quote Senator Bernie Sanders again, by separating health insurance from employment, we would also promote innovation and entrepreneurship in every sector of the economy. People would be able to start new businesses, stay home with their children, or leave their jobs that they don't like, knowing that they would still have health coverage for themselves and their families. Employers could be free to focus on running their businesses rather than spending countless hours figuring out how to provide health insurance to their employees. Working Americans wouldn't have to choose between bargaining for higher wages or better health insurance. Parents wouldn't have to worry about how to provide health insurance to their children. Americans would no longer have to fear losing their health insurance if they lose their job, change employment, or go part-time. Seniors and people with serious or chronic illnesses could afford the medications necessary to keep them healthy without worrying of financial ruin. Millions of people would no longer have to choose between health care and other necessities like food, heat, and shelter. Because of the inevitable suffering about to be caused by the sunset of the Health Care Access Fund in 2019, I would support maintaining the 2% provider tax on insurance companies that pays for this fund. But extending the provider tax won't solve the problem of providing health care to the most vulnerable people in our state. The only system that has a proven record of success around the world in providing health care to all its citizens in a cost-effective manner is a single-payer health care system. So why are we waiting? The marketplace should not be allowed to legislate life and death. It's time to stand up to the mercenary medical insurance lobby that places profits above the health and safety of the people. Thanks for joining me, and vote right, and let's get growing.